So when we think about injuries, we can break them into two types effectively. Acute injuries and then the recurring chronic or longer term or accumulated injuries. An example of acute injury is spraining your ankle. You fall off the edge of the road and you just turn your ankle and it happens in a moment. There's not a lot we can do about these day to day. So today I want to focus more on these accumulated injuries or the chronic injuries or the recurring injuries. And these injuries are more common with runners. We can break this into three types of injury. We can think about muscle tissue injuries. That's the muscle itself, so where the belly of the muscle is, that can become torn or ripped. We've also have connective tissue injuries. That can be the tendons, the material that connects the muscles to the bones, or the ligaments. That's the material that connects bones to bones. And these can become overstretched, inflamed, you can get tendonitis. And you've got a third category, which is the hard tissue injuries. Most common in running is the stress fracture, where you've got a repeated stress on a particular part of the bone that creates micro fractures that accumulate over time and eventually create a lot of pain and a crippling injury at the end of it. A lot of the common causes of knee injuries over time, and particularly with running, can come from muscular imbalances, tight connective tissue. For example, a lot of runners will suffer with a tight ITB, iliotibial band, that can create tracking issues for the patella itself. Patella, that floating bone, the kneecap that's over the front of the knee, that can be, if it's not tracking really well, it can create a lot of pain and strange articulations that can stress the joint itself, but also the connective tissue. And that can become inflamed and injured with overuse. So in essence, what we are trying to do is look at mechanisms to control loading, but still allow overloading. But make sure there's sufficient rest to recover, let the body to adapt before we overload again. And we can do that by reducing our intensity, our speed, our distance, but also by making technique changes. But if we're making technique changes that are too radical, we'll increase the amount of work that needs to be done by the muscles to adapt to that new way of moving. So it's very important we make very small changes to our running technique if we're going to do that. Small changes will create a small overload. Then we need to give our body time to recover, to adapt, and be strong enough to manage that new change in our technique before we make new changes. So we're going to make gradual changes over time. We're going to reduce the exposure in terms of intensity and distance, and that way we can control the overload and control the risk of injuries occurring during our training process.